Alright, so this is the Pyxis ES Med Station. To sign in, you just come in and you start putting in your credentials. You don't actually have to touch the touch screen to get it to start, but you can if you want. It is faster to just type it in. Then you'll have to do your biometric, which will be your finger to sign in. This is the home screen right here. And the first time that you log in, what you're going to want to do is go to My Patients, find your patient. So if that's Cal Tahoe, you'll do Cal for Cal Tahoe Restock. Or if you're Tahoe Douglas, you'll do Tahoe Douglas. Click the patient. That will take them from the active side over here, the search menu, and put them into your shopping cart. It's kind of like being online. So you've got your patients over here and your shopping cart over on the right. So you click on your patient, puts it in your shopping cart, and you can accept to check out. Once you've done that, you never have to do it again. You've basically set up your patient list. So when you come into your home screen and you hit My Patients, it will always populate with your patient right along the top. That's a convenient feature that helps make it a lot faster for you. When you're going to do anything within the system, you have to pick a patient and then pick an activity. Pyxis is designed to be patient-centric. So you choose your patient and you can waste, do returns, or do removes. For the most part, we're going to be doing a removal. So I'm going to click Remove. A list of the medications that are available for removal, which will be for restocking, are made here. You select what your medication is going to be, and then you indicate how much you need. So if you administered, say, 100 micrograms, you would input 100 micrograms here and hit OK. That's going to take it from the shopping area and put it into your cart so that you can check out. Once you're ready and you've selected the amounts that you need, you go ahead and hit Remove Med. It's going to populate a spot that says Clinical Data. And in this case, you're going to put in who your patient's name is, and then you're going to put in the amount that was administered. Okay, so we've entered the patient's information and then the individual that gave it. In this case, we've put a date because we're not taking this video at the same time. So Pyxis is going to prompt us to do a removal. It's very important to watch what it's telling me to remove. So I'm going to remove 1 injection. It should always prompt you in that way, but it's important to look at that. When I pull it out and open it up, I need to check and make sure that I'm looking to see how much is actually here. And that's super important. If it's not right or if it doesn't match, we got to make sure that we're double checking and looking at what we're doing. Here on the screen, there's 2 options. One is waste now, cancel, and the other is waste later. You don't ever remove a medication and hit cancel. That's absolutely a big no-no. Never, never, never. We should always waste now. But if you take the medication and close the drawer, Pyxis will default to having hit waste later. So it's very important to note that if you're pulling it out and you just close it, it automatically accepts and it automatically says that you wasted later. So in this case, we just hit waste now. It's now prompting me to close the drawer. So I close the drawer there, and then I need a witness to document my waste. So this would be whoever your EMS partner was or whoever actually witnessed in the field. But you should never witness unless you actually physically visualize them wasting. So we'll go ahead and have my witness. And now our transaction is complete and we can sign out. All right, so if you close the drawer without hitting waste now, it will automatically accept that you have wasted later. When you do that, it's going to create an undocumented waste because you never documented within the system that you performed the waste. When you log into the system, this banner will appear here that says that you have undocumented waste. The easiest way to get to it and to clear it is to click right here and to click your patient and then click waste. Once you do that, it's going to bring up a list of any undocumented waste or any transactions. What you want to do is actually read what it says here in the green. So undocumented waste, witness required, versus just having a witness required. So if the transaction was performed correctly, it will say witness is required. That would allow you to waste additional amounts, which is really a function that is more designed for nursing. So you can ignore that. We really only care about the undocumented waste. So what we can do is we'll clear one of these here. We have this one that we know we can clear. So you click the one that is your transaction with your name on it. It brings it over to the shopping cart. You hit waste just like normal. We enter the amount. We accept, and then it's going to require us to have a witness. Then it's going to drop us back to our undocumented waste location for our patients here.